Hoosier families can now access data about COVID-19 inside long-term care facilities on a federal agency's website, but there are questions about its accuracy. Good evening, everyone. Thanks for joining us. I'm Bob Donaldson.
I'm Debbie Knox. In some cases, that list shows a lower number of deaths than what facilities have told us. CBS 4's Kelly Rinke is in our newsroom now with a look at the numbers. Kelly.
Bob and Debbie, for months, we have been fighting hard to get you more information about COVID-19 cases inside Indiana's long-term care facilities. That's because the state only provides aggregate totals. A federal agency did publish its own list earlier this month, but these new numbers are making this even more confusing right now. It was the first time you could see which nursing homes in Indiana have had COVID-19 cases. The Centers for Medicare and Medicaid Services published it in early June based on what facilities report to the CDC. This list shows how many cases and deaths centers have recorded as of June 7th, but sometimes the numbers don't add up.
I think it's a safety issue, right? Folks need to have the best information they can to make informed decisions for their loved ones.
AARP Indiana is noticing the discrepancies on this chart too. Look at this. CMS's chart says as of last week, no residents died of COVID-19 at either Homewood Health or Bethany Point. Yet the company who operates these facilities confirmed more than 20 deaths at each nursing home. Over in Franklin, federal data shows one resident has died of COVID-19 at Otterbein. That facility, though, has told us at least 16 people have died. CMS acknowledges that this is preliminary data, and they expected accuracy of those numbers would need to be refined over time.
We want to trust that the facilities are reporting the right data, and we want to trust that they're taking care of our loved ones.
All nursing homes are required to report COVID-19 data to the CDC, but they do not have to submit data for cases that happened before early May. They can if they want to.
So we're not getting a full picture of what has happened in that facility.
We cannot cross-reference the federal agency's data with a list from Indiana because one is not available to the public.
While we have chunks of time, we don't have a cumulative list of every facility, all of their cases, and all of their deaths.
We asked state officials for a comment on this federal data. They maintain that communication from the facility to residents and their representatives helps ensure that information is accurate. Long-term care facilities are still required to report COVID-19 data to ISDH.
We also have over 30 other states that are already reporting this data that I'm sure we could call and ask how they're doing it.
And this federal data shows more than 40 Indiana nursing homes have not reported those numbers as of June 7th. These numbers from CMS will be updated every single week. And a spokesperson for the agency tells me they are working with states to make sure everyone is on the same page so that data is reported correctly. In the newsroom tonight, I'm Kelly Rinke, CBS 4 News.
Kelly, thank you. Today, the state